Hello, everybody, and welcome. And thank you so much for joining us on this panel discussion. And really, this event is designed for parents and caregivers of children with fatigue and related conditions. And really, what we want to do is understand more in terms of what's going on, and even more importantly, what they can do to support their child's recovery. So today we're going to be hearing from a range of people. We're going to be hearing from people with lived experience, both someone that was ill as a child and recovered, and also a parent of someone who was ill and again recovered. And also we're going to be hearing from people that are professionals working in this field. So my name's Rachel. I'm the chair of a patient advisory group on behalf of COFFI, and COFFI stands for Collaboration of Scientists. I have to read this out on fatigue and other symptoms following infection, and I'll put more details about COFFI in the show notes. And I came into this work because I had long COVID myself, and then recovered from long COVID. And even though I was 47 at the time, I know how important my mother was to within my recovery journey. And after I recovered, my daughter then developed chronic health issues, and I experienced the journey again, but from the other side. And as a parent, I know how much I needed some of these ideas that you're going to hear tonight, and the reassurance, but also support to try and navigate her struggles. And at the same time, try and take care of myself during this difficult period. And more I see parents arriving into patient groups, being very overwhelmed, being really frightened and unsure where to turn. And I see them being given really poor advice and really conflicting advice. And being directed to online spaces that unintentionally actually increase the fear rather than reducing it. And so, what I want to do tonight is to share some pragmatic, hopeful, evidence-informed ideas and interweave these with stories of recovery to really offer reassurance and a sense of hope and direction. And whilst this event is primarily for parents, actually, it could be for any caregiver as well. And really, people that have actually got these conditions themselves will also benefit. So I'm going to introduce the panel, and I'm so excited of the people that have volunteered their own time to be here tonight. We have Fiona Symington, and Fiona developed firstly chronic pain at the age of 11, which then eventually became, she also then developed ME, CFS, and other, multiple diagnoses. And luckily also then recovered. We've got Clare Berrington, and Clare's son developed ME/CFS, and Clare helped him recover. She's also a retired occupational therapist, and now helping other parents to help their children recover. So she's going to share their journey and some of the things that helped. We've got Dr. Maria Pedersen, and Maria's a pediatrician, but also a researcher who studies fatigue and recovery. And so she'll talk about some of the risk factors and what the research is showing in terms of recovery. And she did her PhD in the Epstein-Barr virus, so we'll also be hearing a little bit about that. We have Dr. Becca Kennedy, and Becca is a family physician. She is in the US working with adults and children with long COVID and some of the other chronic conditions that occur. She's also the chair of the ATNS, and I've got to get this right, the Association of Treatment for Neuroplastic Symptoms. And you can find out more about them. We'll link to the show notes as well. And then we've got Jamie Shafir, who's a child therapist who works with children and parents and supports them both emotionally and also practically, both again with chronic pain. There's a lot of crossover and also these fatigue conditions. And so I'm really grateful for you all being here. And I really want to start from the patient perspective, and I want to start from Fiona. And Fiona, I'd love it if you could share a little bit about what was that like being 11 years old and developing, this pain and then later on fatigue and some of the other symptoms? Tell me what that's like.
Yeah, thank you so much, Rachel. It's really lovely to be here today and to talk with everybody. So I'd been fit and healthy and going to school before I developed pain. And I had a couple of different incidents that led up to developing pain. So I had a fall from a horse and I also broke my ankle. So a couple of things that sort of went wrong with my body, but at the time not anything I really gave very much thought to. And the pain developed sort of a bit out of the blue 6 months later. And what was it like? It was awful. It was really frightening. It was really, my whole life kind of got tipped upside down, and very much a situation of going to the doctors and thinking that I would come away with some medication, maybe being told that I'd had a sprain and maybe some crutches, and I just expected to get better, and that's not how it worked. And developed the ME in my early 20s, and probably similar, actually had a series of viruses, and very much felt like I was going to maybe rest for a bit, maybe I was a bit burnt out, and then get better. And of course that also didn't happen. So very disruptive, and I think particularly being 11 and going through secondary school, and already a big change, and a time when you've got to navigate so much, and there's lots of change, there's lots of ways, and you're sort of growing and changing, but suddenly to throw symptoms in the mix and be going to doctors and being told, well, we don't know what's wrong with you, and very much an experience of some doctors and some nurses not believing me and thinking that this was about attention, and some people very much believing me, but also saying that, well, we know that you're in pain, but we don't know what to do about it, and we've got to help you manage it, which is something I was very resistant to hearing. And I just wanted an answer. I just wanted things to go away. And I know from my parents as well, juggling a busy life, and I had siblings, and my dad had a stressful job, and very frightening to add into the mix and to not be able to help and make this go away. And that was a very, I also then as their child picked up on the worry, so felt very very responsible for kind of causing these problems for them, and not being able to make them go away. And I was when the tests and the scans sort of didn't really come back with a clear answer, and they tried medications, I had these long inpatient stays in different hospitals and doing physio and having other tests. And so suddenly from home on my own, and my schooling was interrupted, and just a real period of actually feeling very on my own. I think there's something about you're trying to do the things that the physios are telling you to do, and it's not working, and nothing's helping, and a real sense of, well, what's wrong with me, and also a situation of losing trust in adults generally. I think there's something about doctors, you sort of really think that they're gonna come along and fix things, and so when they don't seem to know what's going on, I think that's a very traumatic situation for the whole family. It's not just the person with the symptoms, but yes, a feeling of really being abandoned by the medical profession that isn't coming up with the answers and doesn't seem to understand what's going wrong for you.
Thank you, Fiona. That sounds, I mean, it sounds desperate. It sounds truly, truly dreadful. And I think that's the
Yeah.
collective of this subject, isn't it? It's not just one person, it affects everybody in the entire
Yes.
family.
Yeah.
Thank you, Fiona. I know that that must just be really hard, even just to relive it as well. Claire, you obviously went through this with your son. What happened there?
Well, he was well until he was 13, although he had a number of sort of minor little ailments. He often seemed to get colds and coughs, particularly through his younger life, but was a well chap, very studious and likes his books, and is more of an introverted sort of guy. He came home at half term when he was 13 and had some sort of viral illness, nothing that you'd call the doctor out for. And after a couple of weeks, he sort of seemed vaguely well enough to go back to school. But I kept on being called up by the school to come and pick him up because he wasn't managing. So we cut his timetable down and down and down. And within a few months, he wasn't able to go to school at all. His main symptom was fatigue, and particularly nausea at first. He was losing a kilogram a week for the first 5 weeks. He had some brain fog. At his worst, he was just lying on the sofa. He couldn't really have much of a conversation because he was just too fatigued. He would have to keep his eyebrows raised up in order to keep his eyes open. Just exhausted, feeling sick and feeling rotten all day, every day. I was initially concerned about his lack of education. All seems so irrelevant now. And shall I say a little bit about his diagnosis?
Yeah, go for it.
So
Yes, Claire.
he was diagnosed locally by the pediatrician about 3 months with ME/CFS. And then I looked around for what I thought seemed to be the best clinic in the south of England for ME/CFS in children, and it was the Bath and Bristol service. We had another diagnosis from the consultant there, and then saw a consultant OT who had a PhD in ME/CFS, and she supported him very, very well. I also had a colleague at work who was closely interested in him, and I couldn't understand why, but she was just new to us, and she said, well, I thought he had ME/CFS because this is my first job back after being ill for the last 2.5 years. And she said, and he will get better. So right from a very early stage, I thought, well, he will get better, so that's okay. I'm not going to be one of those ones whose children don't get better. So I always had that hope, and I think that was really important. And we had very good support. Unlike poor Fiona, we had good support from everybody. Not knowledgeable support from the medical profession because they're not trained in these. So, and not even from the OT who was good up to a point, the NHS OT, but we got from, he was about 20% up to about 40% of his normal activity levels, and he was plateauing, so we stopped that.
Claire, thank you so much. And again, I literally can't imagine how horrendous that was for you. I mean, what was the impact on you?
It was awful. We were just worried sick. It was particularly before we knew what it was. And then, of course, when you do know what it is, it's not that much better. And I was so worried about his education, and I was so worried of his social life, which was zero because he hadn't got the energy to see his friends. And it was just miserable all around for everybody. And I was by myself, so I had to go to work and leave him to be ill at home by himself. None of it was great. It was
no. Claire, thank you. And I don't want to plot spoil to anyone listening, but this does have a happy ending, doesn't it?
Yes,
so we will come back to that. Need to just get that in there. But I want to turn to Maria. And Maria, I know you're both a pediatrician, but also a researcher. And I'm just really interested in the from your research, what happens in these cases? What are sort of the risk factors, and what do we know is happening maybe? I know these are big questions, Maria.
Yeah, it's a big question. Thank you, Rachel. So in my PhD, we were looking at adolescents who were infected with the Epstein-Barr virus. So we gathered actually 200 adolescents that were acutely infected with this virus, because we know that this virus, giving the kissing disease, are also one of the viruses that are known for causing chronic fatigue. So we gathered them as acutely as we could and looked at them 6 months later as well. And one of the things we were interested in was, what are the risk factors for those being chronic fatigued at 6 months? And at 6 months, out of the 200s, we looked at approximately 10% would fulfill the criteria for CFS-ME, but almost 50% were substantially fatigued and what we called chronically fatigued. And one of the main risk factors was actually how, during the acute phase, how anxious you were. And being anxious, it seems like for some it's so negative, but actually it's also a positive trait. If you look out in the forest, an anxious mouse, worried mouse will survive much longer than a happy-go-lucky mouse. And additionally, in addition to being a bit anxious, we found that being physically active during the acute phase, we measured how many steps per day were these adolescents doing. It was really interesting. We found that actually being more active during the acute phase was positive. They were less fatigued 6 months later. And we as physicians have been telling our patients for so long, just keep still, keep in bed, but bed rest is out. It's better to be a bit active, not go for a marathon, but be a bit active. Another interesting finding was actually those adolescents that were good at learning things. We tested how good they were at learning random numbers, and those scoring high on learning things were also at higher risk of getting more fatigued. And when we saw these results, we were like, how can we explain this? But now, what has happened the last 10, 15 years with us understanding that symptoms actually is a brain function, and that if your brain is good at learning random numbers, it's good at learning other things as well. And as symptoms being a brain function, it could actually do this associative learning and other forms of learning, making the symptoms stick for longer. So that was some of the risk factors we found in our research.
Maria, that's amazing that when they're moving more, they're less likely, when they're moving more in the acute phase, that, I mean, that's a paradigm shift, isn't it? When everyone says when you get a virus that you've got to rest as much as possible so that you don't get some post-viral fatigue. That's a complete shift. That is incredible. And I love what you say about the memory. That is amazing. Fiona, I'd love to know whether any of that resonates with you at all.
Yeah, so I think that I love this idea of being a worried mouse. I'm going to think about myself about it in those terms in the future, because I know that I'm prone to worrying and I'm prone to perfectionism, and actually it's been part of my recovery to understand that, but in a way that's just helpful. It's just about learning information about me and what's made me prone to different symptoms. It's not a negative. And I think I look back to being 11 or 12 and I know people were saying you're a worrier and you're anxious and you're trying really hard at school. And at the time, I remember thinking, well, what's wrong with these people? Of course I'm worrying, I'm in pain, and it's not normal to be in pain when you're 11. And it's a very big stress, actually. And so I think that I remember feeling very threatened and very, very cross with people trying to say this. And I couldn't see, I remember thinking, well, are they saying I'm weak, that I'm a bit anxious, and so I'm suddenly making the pain up or wanting this attention? And actually, I just understand it in such a different way now. And I think that, thanks to doing the work I've done on my recovery, I just look at this as information about myself. And I know lots of recovered people, and they also would say that they're maybe a bit prone to anxiety, or they're sensitive, or they're perfectionists. And it's something that actually there's so many positives. I know that it leads into me being creative, and I'm kind, and I'm gentle, and there are all sorts of really good things connected to it. So it really resonates, but in a very different way now to what it would have done when I was a child, I think.
Yeah, there is a reason why a lot of the people that have recovered have all become friends
Yeah.
because of these similarities and because
Yeah.
of these great characteristics. Claire, does any of this resonate when you think then in terms of your son and what might have led to him being ill?
Yeah, I mean, we followed the advice of to stay fairly still and not push yourself too hard. And so we looked upon moving around as a bit of a danger and something to avoid. And we were very careful that, I remember for his one of his birthdays, I think it was the second year in, I timed it. We got to this place where we were going to have a picnic, and I timed it. I put on 20 minutes. I said, okay, we can have 20 minutes here, and then we're going to get back in the car. I mean, that's just not normal. And so it was all this sort of worry about, you do this, otherwise you're going to have these problems. So that fits. And also, starting high school and having to make friends and all that, that's a bit of an anxious time for some people. And I could see that. And he was a very hard worker, a good achiever at school. Those sort of perfectionist tendencies, but they can be very good. You know, the perfectionists of the world are the ones that achieve a lot and progress the world. He was a bit of a people pleaser, and at primary school he was voted by his friends as the nicest boy in the class. So there are good and bad things to these traits, but these traits are very common. So I find out get these mind-body conditions.
And Claire, you were just following advice, weren't you, when it came
Yes,
to
yes, yeah,
pacing and limiting activity and
yeah.
and
I'm being fearful of them myself, which of course then my nervous system was giving out fear. His nervous system will have picked up on that.
Yeah, that's it, isn't it? That's key in terms of the parent-child relationship, I think. Becca, I know that you deal with adults and also then parents and children. I'd love to, just from a medical perspective, find out a bit more about how do you approach, parents and children and work out what's going on.
Well, I think it's really important to be very communicative, collaborative, comprehensive. And there is so much uncertainty and fear in all of this. So, as the GP or the primary care physician, it's important to make sure that we've really assessed everything thoroughly. And so, I think, first of all, with treating ME/CFS through a mind body lens, we have to know for sure if there's anything else that's causing these symptoms, and that's key. And many people are in this world are probably watching this webinar because they have had a huge assessment and haven't found answers. But that part is really important. And so talking with the parents and the kids together about figuring out, what tests are important to make sure to rule out any underlying structural illnesses. And generally speaking, that's not so difficult. Like often it is the regular tests that we can get done in our regular clinics. And also it's, I think, also important to understand that the way that doctors work with patients is also collaboratively over time. So it's assessing, getting the symptoms, examining the person, getting the tests, and then also following up and seeing how symptoms progress or change is a big part of what you do with working with a patient as well. So then deciding, well, are there other tests at this point that are now important to do? And so really finding that balance of not overdoing tests, because I think that's part of the problem is that we do lots of great comprehensive tests. We haven't found the answer. The symptoms persist. And then often, unfortunately, people can go down a rabbit hole of getting more and more and more and more tests that end up causing problems a little, just in that there can be incidental findings, meaning that something is abnormal, but it's not actually the reason for the symptoms. Or there's a lot of tests out there that are not actually scientifically valid, but then you're seeing the test, in black and white that it's abnormal. So really being able to distinguish all of that together. And I think the other big piece is really being able to know the patient, the parents, the kid, the teenager, the adolescent, and really being able to talk about what is going on in your life. Sort of these things like the personality traits, and also what could also be other triggers in a child's life that set the stage from stresses they've gone through before, and also what's going on right then, so that we can really work together to put together the pieces of what's happening in their life, what's happening within themselves, that can be a lot of what's driving the brain to be perceiving danger, and then the warning signals that are then stuck in place.
Thank you so much, Becca. And I certainly see it on a patient group where there are tests that, I don't know, like someone on one of the patient groups was talking about being tested for Epstein-Barr virus reactivation. And she talked about IVG being positive some of the time. And is that a problem with just the interpretation? I don't know if anyone can speak, whether you can speak more in terms of some of the specific tests.
Well, you would your whole life you will see that you have had Epstein-Barr virus infection, so your immunoglobulins will be positive the rest of your life. And for most of us, it's important to know that 95% of the adult population has been through an Epstein-Barr virus infection. And many of us don't know when we had this infection. It could be just a simple cold or no symptoms at all when we were younger. So the adolescent population is more in risk of having more symptoms if you get this illness during adolescence. And it's also a virus that is within our body, but it's not dangerous unless we have some immune deficiency or something. So you would find traces in everyone who's been infected. So it's we will find, if you look really deep within the immunology and our immunology cells, you see that the Epstein-Barr virus infection do some changes in our immune system, as all virus does to our immune system. It's great. The immune system is learning, and that's a positive thing. But it doesn't correlate. It has no association with the sensation of fatigue. So if we look at the immunological changes in regards to fatigue, you would more find those with related to autonomic changes. So not the viral infection itself.
Okay, so if you've got higher sort of sympathetic nervous system activation, then that would be the cause. Thank you, Maria.
A lot of patients have gotten tests that they're told are abnormal and are the reason for the symptoms. And it's really important to understand those tests. So they can be things like what Maria talked about, the Epstein-Barr virus, or chronic Lyme, or mold, or heavy metal toxins, or, there's lots and lots of different tests like this that are generally not the mainstream medical tests. And the reason why is because generally, well, a couple of things. A lot of them have not been scientifically validated, despite actually having tests and studies done on them. It's not that the tests and studies haven't been done, but they haven't been shown to be the reason for the symptoms. So for instance, with Epstein-Barr virus, what we're testing is an antibody, which means that it's the body's own normal, healthy response to the virus. It's not the virus itself. And as Maria was saying, 95% of the world's population has a positive Epstein-Barr virus test because it's just a normal antibody. We've been exposed to it throughout our life. And the same thing with things like mold or chronic Lyme is that those abnormal tests have not been scientifically shown to be the reason for the symptoms. So if we look back at, well, why did someone get sick? There are these risk factors, or the hypervigilance in someone's brain, or what their brain and their nervous system is in place, and then they get sick with a virus, an Epstein-Barr virus or COVID, or lots of different viruses, and that can be the thing that tips people over the edge. The virus goes away, like our body fights the virus, like with Claire's son, but then the brain's protective signals is what is persisting. And in that part, that's the counterintuitive part where we need to move instead of rest. I mean, when we have an acute illness and we're very, very, very sick with the acute illness, resting does make sense so that our body can fight the illness. But once that signal gets stuck in place, then it's leaning into it and showing the brain that we actually don't need those signals anymore. And that's not easy, and it's counterintuitive, but really understanding all those pieces. But it's not about an ongoing infection.
Thank you, Becca. Jamie, you obviously work with children and presumably parents as well. I'd love to hear a bit about how do you, once they've gone through the tests and we're satisfied this is a mind, body, a brain, a function of the brain, how do you then start to work with this group of people to start to help them? and support them?
So oftentimes it's the parents reaching out. And so what I like to do is I actually like to offer a consultation to the parent or parents to really get a sense of what's been going on and what messages they've received from doctors. Because oftentimes it's the parents that are really bought in to this approach. And then if we think I'm a good fit, then I like to have a consultation with the child because the child might have a different perspective than the parent. Maybe they're trying to differentiate from maybe they're trying to separate from the parents. Well, that's my parents' perspective. Let me tell you what I think. I would love to hear what you think. Let's talk about that. Because then on the front end, I can really get a sense of what the parents think are causing the ME/CF symptoms, right? What the child thinks, and then I can really tailor that education around fear and avoidance to both of them and see that there's more of an understanding cohesively within the family so that we can all really work on conveying messages of safety to this child. So there's the education around fear and avoidance and how the brain's perception of threat kind of perpetuate a lot of these symptoms. And so once that education is done, then I tend to like to lean into, okay, well, what's happening emotionally? And so when I'm asking these questions, I might ask something like, well, when do you notice that the volume knob is turned up on your ME or your CF symptoms? Because as the clinician, I want to see, does this child notice what's happening inside of themselves? Are they observing that? Do they care about what's happening inside of themselves? And then also I'm asking the parents, well, when do you notice the volume knob get turned up on their ME, on their CF symptoms? Because I want to see if there's kind of a difference in perspective or if there's an overlap, because that can also be intervention points. And really working with the child to place love and care on their feelings and practice self-compassion and then getting to a point where once there's the education of these symptoms don't mean harm, right? And we've placed love and care on their feelings and processed a lot uh, around what's going on with them, then I think that there's this opportunity to lean into, okay, well, what's fear and avoidance really taken from you? Like, what are you really, really looking forward to getting back to doing? And so one of the things that I look for in sessions is like, where is this kid's spark? What do they get excited about? One of the children that I work with, like she loves dance. And so director brain breaks, she's teaching me dance in sessions sometimes, right? So there's that interrupting me mid-sentence. Okay, we're gonna do dance. Great. So I now know that we have the rapport for her to interrupt me, and I see her taking an empowered stance, right? And so I think that there's so much value in that collaborative partnership and building that in. And so there's education, there's the emotional processing, there's the exposure work in session, and then sometimes children might feel tentative about this. There might be questions, and so I think that as clinicians we can ask, well, how worried are you that this activity might turn up the volume knob on your symptoms? And really having a back and forth with the child. And sometimes what's actually like a pretty magical moment is when the symptoms come up in session when we're talking about the activity. Well, we're not doing this activity. We're imagining this. What do you make of that? Oh, we're not. We're not
Wow.
playing soccer. Okay, so you have such a powerful brain. Can we talk about this? Like such a powerful brain. And so building up that awareness that, okay, well, maybe that's an association. that gets learned, but that's not actually, soccer's not the problem, right? And sometimes what can really help with motivation, if the parents are quite collaborative too, is I like to build out reward charts. And so this is something with younger children and even slightly older adolescents, is the reward chart can be charted out throughout the day. So morning, afternoon, afternoon after lunch, late afternoon, evening before bedtime. And anytime the child practices like an exposure or leans in towards practicing self-compassion for themselves, they get a star and they can get a reward after. I tend to like to have those be more relationally based, like spending extra time with parents if that's appropriate, or doing something fun that they don't normally get. Always talk to the parents beforehand, though. I wouldn't float any reward ideas to a child first, but I think that that can really help with motivation too.
Wow, I love the bit where you get them to notice the patterns themselves, where they're imagining the activity. That must be such an aha moment, and a real turning point. Um, Claire, I'm going to come to you because I know we were talking about aha moments, and I want to know the end of the story. What did you do? What did your son do? And then we'll find out what happened with Fiona as well. But what did you
Well,
do?
I found it a bit odd how, like, right at the start, when he was having an awful lot of nausea and he was losing all this weight, we went to this homeopath, and it was up 2 flights of stairs, and he could do these 2 flights of stairs absolutely fine. But at home, he could hardly drag himself up the stairs once. You know, it was down in the morning once and up in the evening once. So I couldn't understand why he could do it at one time and couldn't do it at another. And it was we were in the bathroom and he was helping me. This is a bit further on. It was about a few years in, and it was before we'd started any of the therapy programs. We'd done the OT one, but not the ones that got him better. Um, and he was helping, but to hold the bathroom sink. But he wasn't doing a very good job. He was sort of leaning it, and he was doing it very half-heartedly. And I kept telling him off about, no, do it this way, no, do it that way, and being really tetchy. And then after about 10 minutes, he said, "Oh no, I can't do any more. I can't do any more." And I looked at him, and his face was grey, and his eyes had swollen up, and he looked like the energy had just been sucked out of him. So he was resting at the top of the stairs with his head in his hands. And I suddenly thought he looked completely fine before, when he came into the bathroom. 10 minutes later, he's looking absolutely like death warmed up. And I thought, I wonder if it's me. I had been spending 10 minutes being negative to him. So I thought, right, well, let's try something else. So I said, okay, well, come back. You've had enough of a rest. And he was holding the sink. And every time he did anything even vaguely good, I said, oh, that's really good holding. Oh, yes, you got that in a good position. And oh, that's a great idea.
Wow.
And I said, if, in a few minutes, it'll all be fixed. And it was. In about 5 minutes, the sink was fixed, and so was he. His colour was fine. He went off. He was doing something interesting. And I thought, right, that's in his brain. There's nothing structurally wrong with him. It's in his brain. He's not imagining it. He's not making it up. I could physically see the changes.
Wow.
But then I realised it was the thought process and the emotion. And so that's what changed my whole way of being with him after that. And that it went from strength to strength after that.
Wow, that's such a turning point. And actually so brave to kind of share that as well, Claire. But it's so helpful, I'm sure, for people listening. And I guess an example in terms of what we talk about co-regulation, but people don't really understand necessarily what that means. But I think you've just
yes, so it was
demonstrated
by giving him positivity during the day, by making light of symptoms. No, I recognize that the symptoms were awful, but I take the mick out of the symptoms. I saying, really helpful, this, isn't it? Because you're too fatigued to do the dishes. And you know, we'd take the mick. He knew I understood.
Yeah.
But take the mick out of it. And I would fill his days with things that were fun and enjoyable and were positive and would always end in success. And every time I did it right, his symptoms would reduce. And when I did it wrong, I got tetchy, he'd get back to be symptomatic. And it was very quickly, within 5 minutes or so of doing it right or wrong, you could see the result.
Wow, and that was the start of the recovery journey. And
Yeah.
where is he now, Claire? I mean,
he is working. Well, he finished, despite having almost no education, secondary education. He did his A levels over 3 years, and then did his instead of 2 years, and he did his degree over 4 years instead of 3. But once he'd done his 2 treatment programs, ANS rewire and nickel therapy, he was started working in a climbing center, and while he's looking for a permanent job, he's cycling to the climbing center. He's working 8-10 hours on his feet, going climbing afterwards, cycling home. Can do everything he wants to do. Yeah,
that is amazing.
Really good. It's really good.
I love that. I love that. And all starting from that recognition there piece. Thank you so much for sharing. Fiona, I know that you didn't recover until you were an adult, but if you went back to the 11-year-old Fiona, you know, what would you have needed, do you think, to have made?
Well, and it's a really emotional experience listening to Jamie and to Becca as well, and to hearing about this amazing compassionate care that's offered. And that's the very opposite of what I had. I was very much, I would call it abuse, and bullying, and being shamed in hospital, and really some very tough treatment. And of course that's not what any of us are arguing for here. And I think that yes, goodness, if there'd been somebody to sit down and work out, well, what brings you joy? And I guess I was a little girl that loved dancing and loved it so much, and loved horses and loved the outdoors, and those are all so motivating. And that was entirely missing. I was in a physio in the gym, being pushed on the treadmill and being kind of shouted at when I struggled, and being forced out of bed, and really tough experience. And yeah, just that kindness. And I think it is that thing of being told, we believe you, we absolutely know that you're in pain, we know this is real, and you're right to be struggling with it, because it's a big deal. But then to be told, well, actually we know that we can help, and that kindness, and allowing the child to be collaborating on their own care is just it's music to my ears, and it would have made such a difference. And I was very unseen in the process of being treated, actually, and sort of felt like a problem to be kind of got out of the way. But no, I think it's incredible, and it's so lovely to think that we've got children now that when they do have symptoms, in an ideal world, this is what they experience. And I know not everybody is doing so, but there's lots of people working so that does become the norm, and that is what's given to families, and it's proper support and care, actually.
Fiona, thank you so much. And I want to just throw it out actually to everyone in terms of, like, how do you motivate, when you're not motivating yourself, but you're a parent and you're trying to motivate someone else? Like, how do you do that? Has anyone got any thoughts in terms of?
That was the hardest thing.
Yeah.
And if you could answer that would be wonderful, because that was so hard to get him to do the hard work that was required. Yeah.
I don't know whether anyone can speak to that in terms of just motivation, or whether it's an impossible question. I don't know.
I could say we talk about what they miss, what you miss doing, what you love doing, your values, what do you want in life. And then when it comes to doing something different, like Claire said, it's really tough to get motivated to do things differently. Then would it hurt to try? How does it work? The way you are coping now, how does that work for you? Try to just get the thoughts going on, well, even though my body is saying I need to rest and stay quiet, that isn't working for me. If I want out, I think I have to do something differently, maybe.
Thank you so much, Maria. Jamie, you're nodding.
Yeah, no, I loved that response. I don't know that there's actually much more I can add. So I think that on the front end, validating, right? Validating that this has been terrible for this child, for the teen, for the parent. for the siblings, like this impacts an entire family system. And so validating that every single person like within that system, they've been through the hope disappointment cycle, and that experience needs to be validated, and then getting curious about, and to Maria's point, like what does this child value, like getting into their world. And I loved the framing of what did they want to work towards,
Yeah.
right? Kind of that reframe of, well, we can't do this, rather than, well, what's really important to you? Because more of the same isn't working.
Yeah. Claire, anything that you found in terms of that motivation question?
In the A&S Rewire program, that's one of the things they do. You have these sheets of paper. It says in 6 weeks from now, and you write it, in 6 weeks from now, I will be, and then you guess what you're going to be achieving. So it's that visualization, imagining what you're going to be. So at least in your head, you've got a goal to work with, and then in 3 months from now, what am I'm going to be doing this and stuff. So that was pretty good. What I found that, in terms of motivating, we would I would try to get him to do things that he enjoyed doing. So I would, and that thing. So we would play frisbee in the garden to begin with, and then when I thought he was ready for it, I'd say, well, should we walk 5 minutes down the road and we'll play frisbee in the dog park. So it was using play as a way to motivate him to get stronger. But I really must say I wasn't very good at it.
Well, clearly you were in the end, because
Well, it was the programs, I think, that did it, really.
Thank you so much. I realised that we're sort of running out of time, but I just want to really throw it out there in terms of whether anyone's got anything else that they think would be really important for people listening to know in terms of prognosis, or in terms of other things that they could be doing.
I definitely, I mean, it's slightly linked to the last point, but I think that, when you've got all this worry about your child being unwell, I think there is so much focus on school and the future and exams, and I know that, having spent 7 years watching people recover and talking to people recover, and I always try to say to people, like, really try and get the focus on joy, because actually what matters is being well and your child being okay. And I think that life can wait, exams can wait, school can wait, and there are ways of things being made okay later on. But so much of recovery is about joy, and when we're feeling joy, the nervous system, it responds to that, and it's likely to stop generating symptoms, and it's sort of getting the message that it's safe. But just taking the time to connect with your child and to allow them to really explore, well, what might make them feel happy. And it's such a lovely part of recovery. It's a lovely part of getting to know yourself. So I would always say, strip everything back and just focus on even just little things that bring your child joy. And I spent so long thinking I couldn't recover, and here I am, and actually there's lots of other people out there too who've also recovered. So just to have some hope that these ideas really do work, and there's so many good people working on research around them and working clinically and helping people, and so we're in a really nice place to sort of have some trust in these ideas now, I think.
Thank you so much. And I'm going to end there. Thank you. That has been an honour. I do know that there were questions that we got asked in the parent groups that we maybe haven't answered. So are you all right if I ask you questions offline that we maybe then are able to give to people watching that have asked? Thank you very much.